Do you run the risk of developing a blood clot in a vein in your legs or even in another part of your body? How do you feel when you have a blood clot, and what are the signs and symptoms? How do you protect yourself from stroke? Are there foods that can prevent blood clot formation? That's right, that's the topic of today's video, which is 7 proven ways to prevent blood clots in the legs and improve blood circulation. What are the most important things you can do to reduce the risk of developing a blood clot or stroke? In the United States, over 100,000 people die each year due to blood clots. So stay tuned and learn how to protect your health and that of your family. I'll divide this video into 3 parts. The first part is about why a blood clot occurs and how it forms. The second part is about signs and symptoms, what you feel and what you should look for if you think you have a blood clot. The third part is the most important, which deals with prevention and how to avoid blood clots. It will be a very comprehensive video, so stay until the end. But first, like the video, because the more people like the video, the more YouTube will distribute it to people who don't have contact with doctors and hospitals, and will also share the video with your friends and family. Many lives can be saved with your help. What is a blood clot? Thrombosis occurs when a clot or thrombus forms inside a blood vessel, obstructing the normal flow of blood. Arteries and veins are healthy tubes in our body, carrying blood to the organs, which is the function of the arteries, and returning it to the heart, which is the function of the veins. Arterial thrombosis can lead to limb ischemia, so there will be a lack of blood in the foot, leg, and arm, and it may even progress to amputation if not treated quickly. Venous thrombosis, the topic of this video, deserves all our attention because it is the most common and can lead to complications that can be fatal. Although more common in the deep veins of the leg, the main site being the calf, a blood clot can occur anywhere in the body. What are the main problems that can arise due to deep vein thrombosis? First, if a clot in the leg vein gets large, it can damage the vein walls, leading to serious consequences. Inflammation of the vein wall can lead to a condition known as chronic venous insufficiency, which causes malfunction of the venous valves, causing chronic swelling in the extremities due to blood clots, and can also cause ulcers and post-thrombotic syndrome. Now there is an even bigger problem. If the clot breaks off and forms an embolus, it can travel through the circulation and cause serious damage. This embolism can hit our lungs, causing a pulmonary embolism, which is a very serious condition, sometimes more serious than a heart attack, and kills many people. Also, the clot can hit the brain, causing a stroke if the person has a patent foramen ovale. Now something very important: how does a clot form? In the 19th century, the German pathologist Virchow described 3 factors that contribute to blood clot formation, Virchow's triad. 1. Endothelial injury, the carpet-like covering of blood vessels. How does this happen? You may have been kicked in the calf or twisted your foot, but there may also have been an infection like the coronavirus that damaged this lining. The second is slow or stagnant blood flow, which can be caused by being still for too long. You had surgery, broke your leg, took a long car or plane trip, or didn't even get off the couch. Research has just found that watching TV for 4 or more hours a day is associated with a 35% higher risk of blood clots compared to those who watch less than 2.5 hours. 3. Changes in blood coagulation, hypercoagulability, which can be caused by genetic factors, medications, or other health conditions such as cancer. Normally, our body contains substances that help prevent blood clot formation, keeping the blood fluid, and other substances that aid in coagulation. If there is an excess of procoagulants, clots may appear more frequently. So who is at greater risk of thrombosis? Just remember Virchow's triad. Number 1. Prolonged immobilization, for example, during a long flight, hospitalization, or after surgery. 2. Aging, the risk of deep vein thrombosis increases with age. 3. Family history, if someone in your family has had it, you are at higher risk of developing it. 4. Obesity, excess weight can increase pressure on the veins in the legs and pelvis, increasing the risk of deep vein thrombosis. Also, visceral fat leads to chronic inflammation, insulin resistance, and increased coagulation factors, which lead to a tendency to form blood clots. And if we add sedentary lifestyle to that, the bomb is about to explode. 5. Use of hormonal therapy and contraceptive pills. 6. Pregnancy, pressure on the pelvic veins and procoagulant factors increase the risk of deep vein thrombosis during pregnancy. 7. Chronic diseases, diseases like cancer, whether cancer, chemotherapy, radiotherapy, or inflammatory bowel disease. Having the disease and heart failure increases the risk. 8. Vein injury, injury to a vein can increase the risk as well. 9. Smoking, smoking can damage the veins and increase the risk of deep vein thrombosis. 10. Dilated veins in the lower extremities, especially those in the thick trunk, which can increase the risk of blood clots. If you push your luck too much, for example, taking contraceptives and smoking, because that doubles the risk of blood clots, contraceptives increase the risk a little and smoking a lot can cause problems. Now, if you've had an episode of blood clots and don't have any of the known risk factors, you probably have a condition called thrombophilia. Let's move on to part 2. How do you feel and what should you watch out for if you think you have deep vein thrombosis? If a clot forms in the leg, you may feel swelling and swelling below the clot site. Swelling is the most common symptom and does not affect both legs. If there is swelling in both, it is probably something else. The second symptom is pain that can be continuous or intermittent and can worsen when walking or standing. You may also feel redness in the affected leg, and it may appear red or discolored, and the skin may feel warm to the touch. Another symptom is a feeling of heaviness or fatigue in the affected leg. Also a tingling or numbness sensation. Another thing you may notice is that the superficial veins will appear thicker and more prominent than normal. There are people who may suffer from low temperature due to blood clotting. If you feel any or all of the mentioned symptoms, do not waste time and go immediately to the doctor to assess whether it is a blood clot. How is thrombosis diagnosed? You go to the doctor and complain of pain and swelling in the leg, and the doctor will examine you. It can identify signs of blood clot, for example, your calf may be stiff and swollen. To confirm the diagnosis, he may request tests such as D-dimer, but the most reliable method is intravenous Doppler, which checks blood flow in the veins and can accurately diagnose clotting. If there is suspicion of pulmonary embolism, other more specific tests such as pulmonary angiography may be requested. Now, important, it is not enough just to diagnose thrombosis, it is also important to know the cause of the clot. Therefore, the doctor should investigate the factors that may have contributed, as this will depend on the duration of the treatment. What is the treatment for stroke? It is usually used with anticoagulants. But prevention is always the best option. We then come to the third part of the video, and what I consider most important: what preventive measures should be taken to prevent blood clots. There are many actions we can take. Of course, in some more complex cases such as cancer patients undergoing chemotherapy, or patients who have already had 2 or more clots, preventive measures may not be enough and we need to resort to anticoagulant medications, sometimes for life. My first tip is to exercise. Stay active, try to take 10,000 steps a day and exercise regularly. This will help keep blood circulation moving and prevent clot formation. And not only that, it will improve your mood, memory, and quality of life in old age. Plant now to reap the benefits later. My second tip: if you are overweight or obese, try the opposite, try to maintain a healthy weight. I'm not asking for much, am I? A 2017 study published in the Thrombosis and Thrombosis Journal found that losing 5% to 10% of body weight in obese people can significantly reduce the risk of blood clots. Another 2019 study published in the Journal of the American Heart Association found that a loss of just 3.3 kilograms or more in overweight or obese women using birth control pills was associated with a significant reduction in the risk of blood clots. Less than 5 kilos is not much, right? My third tip: if you smoke, stop immediately. Cigarettes damage arteries and veins, cause inflammation, increase platelet aggregation, that is, blood thickens, and damage the endothelium, that carpet that lines blood vessels and essentially reduces blood flow to the extremities. Think of colds and impotence in hands and feet. My fourth tip: avoid standing still for too long. Exercise. If you're traveling by car, try to stop every 2 hours to stretch your legs. Avoid standing with your legs crossed for long periods to avoid pressing on blood vessels. If you are traveling on a long flight, try to walk down the aisle at least once every hour. Go to the bathroom walking on tiptoe and also on your heels. When sitting, do exercises for your ankles, move your feet up and down and in circular movements, and also your knees. Lift your knee as high as possible and hold it for a few seconds before lowering it. Also, if you already have any circulation problems such as swelling and varicose veins, compression elastic stockings can be very helpful. They are designed to apply gentle pressure to the legs, which improves blood circulation. And of course, avoid using tranquilizers, sleeping pills, or alcohol. These substances can impair your ability to change position and stand during the trip. It is also important to remember that in surgical operations, one of the main methods of preventing blood clot formation is early ambulation, that is, walking. In cases where patients cannot be moved, we can use compression stockings or pneumatic compression devices to improve circulation. Most of the time, anticoagulants are used prophylactically until the person starts walking. Tip 5. Stay hydrated. Dehydration can increase the risk of blood clots, so it is important to drink plenty of water throughout the day to maintain blood flow. It is recommended that women drink about 2.5 liters and men 3 liters a day. If you exercise, you may need to increase this amount a little more. Tip 6. Know your risk factors. What is your family history of blood clots, age, pregnancy, use of contraceptives or hormone replacement therapy, and other medical conditions that may increase the risk of blood clots? My 7th tip: eat foods that can prevent blood clotting. A healthy diet rich in fruits, vegetables, and antioxidants can help reduce the risk of blood clots. Unfortunately, there is no miraculous food that prevents the formation of these clots, but I will mention those that make the greatest difference. I leave a warning here: these foods should not be used as substitutes for other medical treatments to prevent blood clots. Grapes, more specifically red wine and whole grape juice. Did you know that red wine can help prevent blood clots? Correct. About 150 to 300 milliliters reduces the risk of cardiovascular disease and also helps prevent clot formation, improving hypercoagulability conditions. This is because of resveratrol. However, it is important to remember that alcohol consumption, even in low doses, increases the risk of cancer. A good idea is to replace wine with whole grape juice. Studies show that drinking a glass of grape juice daily can reduce blood clot formation and improve platelet function. Food #6 Garlic contains compounds that can help prevent blood clotting, especially allicin, which reduces platelet adhesion. To get the benefits of garlic in preventing blood clots, it is recommended to eat raw garlic and let the garlic rest for about 10 minutes after chopping or crushing it to allow allicin formation. Food number 5. Olive oil is a monounsaturated fat rich in oleic acid, which has anti-inflammatory and antioxidant properties. Studies have shown that regular olive oil consumption can help reduce the risk of cardiovascular disease, including blood clots, by reducing platelet viscosity and blood clot formation. Food 4. Turmeric. Turmeric, also known as turmeric, contains a substance called curcumin, which has anti-inflammatory and antioxidant properties. In addition, curcumin can help reduce blood viscosity, reducing the risk of blood clots. But for better absorption of curcumin, black pepper is necessary. Studies show that adding black pepper to turmeric can increase the absorption of curcumin by up to 2,000%. Food number 3. Cocoa chocolate contains flavonoids, which have antioxidant and anti-inflammatory properties, which helps improve endothelial function and reduce platelet adhesion and blood clotting, which can reduce the risk of venous thrombosis. In addition, cocoa contains polyphenol, which can help reduce blood pressure and improve blood vessel health. However, it is important to choose chocolates with high cocoa content, at least 70%, and avoid types with added sugar and fat, which can have negative effects on health. Food 2. Strawberries, raspberries contain antioxidant compounds, anthocyanins, which can have beneficial effects on cardiovascular health. These compounds reduce inflammation and improve endothelial function. In addition, studies show that regular consumption of red fruits can reduce blood clot formation and improve blood circulation. Finally, the fish. Number 1. Deepwater, salmon, tuna, sardines, and mackerel are an excellent source of omega-3, especially EPA and DHA. These fatty acids have anti-inflammatory and anticoagulant properties, which means they can help prevent clot formation. Now, if you are vegetarian or vegan, nuts and walnuts also contain omega-3 and vitamin E that reduce blood inflammation, improve blood vessel health and endothelial function, and reduce platelet aggregation. Certainly, the key to preventing venous thrombosis is to follow a healthy lifestyle, including regular exercise and a balanced diet, staying hydrated, and avoiding standing still. But if you suspect a clot or clot somewhere in your body, it is important to see a doctor quickly to start the appropriate treatment. Did you like the video? Remember to share so that more people have this knowledge. Every week has valuable information about health. I also left a reliable link below for a medicinal garden kit. I think everyone should have a medicinal garden in their backyard. That way you can easily choose the medicine you need at any time. Your backyard pharmacy will be by your side even in times of crisis. You will also receive a free copy of the Medicinal Herbal Guide, From Seeds to Remedies. This guide will show you how to turn these 10 plants into tinctures, ointments, poultices, decoctions, infusions, essential oils, all in great detail so you can follow our guide even if you have never made a herbal remedy in your life. Until the next video, take care.